calling us people with insert female body part, menstruators or birthing people,
people who can get pregnant, people who can get other people pregnant, people who are at risk of testicular cancer.
She would be deducted points if she didn't use inclusive language, such as birthing body. Said, well, I hope you do know there are people in worse off situations than yourself. You're clearly privileged.
Discussion about systemic pain bias in healthcare.
Hormones took away my ability to have kids. It will affect your whole life. Called me fat because how dare I go against their worldview that fat is healthy.
I'm the trauma holder.
They don't even know how to cosplay this disorder right. Hey guys, it's Misha and welcome back to my channel. So today I am once again reading about your woke experiences, and this video is going to be about health and politics, how a certain political ideology can affect your mental and physical health. We're going to be talking about different social media platforms like TikTok, of course, glorifying mental illness, promoting a victim mindset. We're going to be talking about the healthcare system. But before we start, please make sure you are subscribed and have hit the notification bell so you don't miss any of my videos. I've never felt like I identified with the woke mob or the conservative mob, but I see myself feeling a little happier in a sense when around Republican/conservative people, when I'm around or watching Democrat or liberal people. I feel like I can watch Republican content all day, but watching woke videos on TikTok for 15 minutes have me feeling mentally exhausted. As someone else worded perfectly, everything now is either us versus them, and how that is being seen as the only way to think. This ideology has severely affected my mental health multiple times since coronavirus started. So I'm glad there's creators out there like you, Misha, who aren't afraid to speak out. Well, thank you so much. And also, I do want to say that I have felt this exact feeling of exhaustion when you are surrounding yourself with the woke left. The common theme you'll find here is a victim mindset, believing that everyone is out to get you. So if you are a woman, it's because of the patriarchy if you're unhappy. If you are black, it's because of racism. If you are an immigrant, it's because of xenophobia. If you are trans, it's transphobia. If you are gay, it's homophobia. There's always something that is contributing to this victim mindset, and you will find that just surrounding yourself around those kinds of people will leave you feeling exhausted, especially when the woke left don't want to see people happy, because when you are unhappy, when your friends are unhappy, you don't like seeing other people enjoying life, okay? Because how can they be enjoying life when there's so much evil in this world, when there's so much inequality and so many bigoted people around us? How can they be happy? And if you haven't, been around woke people, if you don't know what I'm talking about, there are plenty of those who are online who talk about how seeing people, privileged people, happy, actually harmful.
White people's joy is not resistance. Like, queer or not, your joy is not resistance. Your joy is what got us here in the first place.
I interviewed for a job at a children's hospital that specializes in mental health disorders and was told they were inundated with kids coming in faking Tourette's. It's awful for the kids who actually need help and can't get it because the fakers are using up all the resources. I think it goes back and forth with Tourette's, DID, OCD, depression, and glorifying that and faking that for attention, for views. And that's unfortunate because, as this person states, there are people that actually really do need help and they're taking away those resources. It's annoying how people like to talk about medical misogyny but refuse to call a woman a woman. They're contributing to the problem by calling us people with insert female body part, menstruators or birthing people. We can't solve problems when we refuse to name the affected people. And I almost never see that kind of language in men's health articles. If you read about prostate cancer or ED, they're usually not afraid to call a man a man. Kind of sus if you ask me. It's sus because the men are far less likely to get offended by it. Meaning, if you take a look at who is talking about being non-binary, or, wanting to be called a birthing person or a menstruating person or a person with a uterus rather than a woman, because that's what it is, it's mostly women, okay? There's not a lot of men going around saying, I'm actually a person with testicles.
My advice is to use language that focuses on function and not just form. That means focusing on the actual function that you're talking about, such as people who can get pregnant, people who can get other people pregnant, people who are at risk of testicular cancer, and so on and so forth.
I work in healthcare as a medical laboratory scientist. I've dealt with sample issues with more trans and non-binary people than I expected. It's confusing because on their chart it has whatever the patient prefers their info be, as well as birth sex. It gets confusing when patients have multiple names and sexes listed. I can imagine. I mean, it's confusing enough when you're in school and you have to memorize everybody's, gender and their pronouns, preferred name. I can't even imagine how difficult that must be. Let's say in a, God forbid, a life or death situation where you have to know who is this patient, right? Like, what are they at risk for? then you have to go through their chart. Oh, they're actually non-binary, but what does that really mean? Are they a person who menstruates? Are they a person who can get prostate cancer? This is so ridiculous. And I want to ask those people who demand that the doctors waste their time on with this nonsense, right? Would you rather someone get all your pronouns correct, or would you rather them treat you and fix your problem? I don't know. I feel like that's more important. I really do. I feel like we should focus on that. And then you can play pretend at home with your ZM pronouns and your non-binary identity. But I don't think we now have to force doctors to play along with your delusion. Not getting patients and samples mixed up is important. And the use of legal name and sex over birth muddies the water. A few years ago when I was 16, I wound up in the hospital after an intentional overdose. The woman who was meant to comfort me and guide me in the next steps from there took one look at me and said, "Well, I hope you do know there are people in worse off situations than yourself. You're clearly privileged." I'm physically white, by the way, not ethnically, but you get the point. From there on, I felt really shit about myself. Then a few weeks later, my cousin, who was clearly a POC, got into a fight and was so visibly clear to me. They had more concern for her because she wanted to throw hands with someone than they did for me. This reminds me, in case you aren't up to date with all this, right? Pain is now racist. Okay, I think we should make a list. Just this year, I have learned so many new things about what's racist and what's not racist. So if you're watching my videos, you have learned at this point that walking is racist. Okay, smiling is racist if you're smiling at black people. Being nice is racist. Giving black people a raise is racist. So everything is racist, we know this, but specifically now, pain is racist. And Advil is very passionate about this pain is racist narrative, but you do know that anyone can get Advil. They don't ask you actually what race you are yet. But yeah, you can get the Advil if you're black, or if you're Asian, or if you're white. So here's that Advil ad for the black pain, introducing the Advil Pain Equity Project.
Believe me when I say,
I'm in pain.
Believe me when I say,
and believe me when I say,
my pain is real.
In an Advil study about pain experiences, 74% of black people said there's a bias in how pain is diagnosed and treated. You can get a bunch of people to say something, but we need the proof. Like, you can't just say, oh, well, yeah, there's a bias.
I'm frustrated that we have to validate our pain just to get treated like human beings.
The healing of the body was easy for me. It's the psychological part. It's awful.
I should not have to beg my doctor to run tests or ask them to take another look.
A discussion about systemic pain bias in healthcare.
83% said they had a negative experience with a healthcare provider when seeking help dealing with pain. You know, I think most of us at this point understand that Big Pharma, especially, does not always prioritize our health, actually. You know, they want to get people medicated. They want people to stay addicted, in many cases, to that medication. And doctors, there are good and there are bad doctors, okay? Some doctors will hand you medicine when you don't really need medicine, just to treat the symptoms and don't go deeper and try to find the root cause of the problem. And there are other doctors, actually, who are suspicious and won't give you that medicine because they know that there are a lot of people who abuse substances and are more careful with that. So there are all kinds of different doctors, and because you've had a negative experience with doctors, with the healthcare system, that doesn't mean it's because they're racist. Okay? And that doesn't mean now we need a black Advil or black pain. Your pain is somehow different. Here's how they're advertising this, okay? 3 in 4 black people suffering from pain believe there is a bias in how pain is treated. Believe. We're going based off of their belief? This is insane. This is medicine. 4 out of 4 insane people believe that they can be Aziz Ansari. So now people can actually be Aziz Ansari? That's scientifically proved. Believe. Insane. I mean, no wonder that's what they believe. If so many people are being taught day in and day out that they are victims, that they are oppressed in America in 2024 as a black person, of course they're going to see racism when there isn't racism. You had a bad experience at the doctor. Unless they're literally, I'm not going to treat you because you're black. And I would love to know how many people have actually had that experience, right? They're saying something racist to them just because a doctor is careful about giving you a medication when you really want one. This happens to white people too. They have to go through it when they're being prescribed something. Or if a doctor just gives you the medicine because they just want to treat the symptoms, which also happens to white people. You can't always blame it on your race. There is no need for a black pain campaign by Advil. Anyone can get the Advil.
So I think like the main thing is that health professionals think that
Black people are biologically different than other people, that our skin is thicker, that we have less sensitive skin and higher pain tolerance. And that is all absolutely false. There is no difference between Black patients and patients of other races.
Black people don't have thicker skin or any of that stuff, but there are certain illnesses that affect Black people more, and there are certain illnesses that affect Asian people more and white people more. And it's important for us to recognize that that exists, because then the doctors can prioritize checking for that in case you are experiencing symptoms that could be related to that illness. Sickle cell disease, for example, with how that affects people of African descent. It's okay to acknowledge that. It's actually important to acknowledge that, because then we can help people faster. What's the problem? This is because of slavery. This is because of racism. But in reality, of course, pain is a sensation that is experienced by people from all kinds of different backgrounds and races. The only thing we should be taking a look at is how bad is the injury or the illness, and go from there. When I was 16, I transitioned. I had BPD and OCD, and no one checked for these conditions. My delusions were believed. I'm also autistic. I guess found out about my OCD at 21, BPD at 23, and autistic at 24. Doctors need to do better. Run all the tests. This is a life-altering choice. Example, I detransitioned in 2020 at 21. All these years later, hormones took away my ability to have kids. It will affect your whole life, not just a small window of time. This is so important, especially because so many therapists now have to immediately affirm their patient's identity. Not many push back and look at the other issues going on, what other mental problem could be playing a role here. My cousin is at uni in Scotland for medicine. She couldn't write woman for her major essay when her chosen topic was PCOS, a woman-only medical condition. She was written up and told she would be deducted points if she didn't use inclusive language, such as birthing body or they instead of she. She didn't do what they said because it's insane, but this is the doctors of our future. They are forced to write essays in gender-neutral language for sex-specific problems. These are the same people that talk about medical misogyny, who can't even say the word woman, and how PCOS can only affect women. So something I've noticed as someone who is autistic and finding out recent diagnosis as an adult. Suddenly, everyone I know is also autistic. Things like TikTok glorify it, and when I address my mental illnesses or my autism, I get, oh, you're one of those people. Or I get, oh, I'm autistic too. Or I get, autism is a mental illness. You can choose not to be it. You drive and go to work. How can you have autism? Due to these accusations, I'm forced to do what's called masking. I don't ask for sympathy. I understand that as an adult, I must do what I need to do to survive. But it's that small percentage on social media that have ruined it for the people who genuinely suffer. Instead of getting the help and support I need, I just get a, that sucks, move on. So it affects my health personally. When I have an autistic burnout, and as a 26-year-old woman, it's embarrassing to see an adult throw a fit, but in reality, I've just stimmed and disassociated because I can't actually handle what life throws at me. I'm just expected to. This also goes with other things too. I have BPD, and suddenly every girl on TikTok also has that. Like, I go to therapy every week because of my trauma, and young girls are ruining it for people like me because they think they're edgy. Exactly. It seems that nowadays everyone has autism, everyone has depression, everyone has OCD. If that's truly the case, then something's going on. Like, we need to figure that out, because it's not like a good thing, right? It's not something you should be ashamed of, but it's not like a, yes, I just found out I have autism. Awesome. Fantastic. I have depression. That is so cool. No, because with that comes many different problems. That's why it's so important to, yes, we should have awareness. They suspect they have this problem, because then they can learn some better coping mechanisms, how to deal with what they're suffering with, right? Instead, have turned them into this glorified, cute, aesthetic, quirky thing that you can just choose to be because you saw it on TikTok. Again, if everyone really does have this, we got a problem. Hi, Misha. I love your videos, and this happens to be a topic I'm very passionate about. There's this one chronically online girl I met a while back. I won't deny that she definitely had autism and narcissism, but the more radically left she got, the more mental illnesses would just suddenly spawn. Some days she had BPD. She was briefly a system.
I'm Luke, and I'm the host of the system. I'm Eras. I'm the protector, I guess. Hi, I'm Ciel. I'm Lunar. I don't know my role yet. I'm new. I'm the trauma holder.
What pissed me off the most is her pretending to have schizophrenia, because I'm clinically diagnosed with that one. And I know people who suffer a great deal from things like ADHD, and that's another one that people think is really cool and really quirky to have. It is not, okay? It's actually very heartbreaking to see how these certain mental problems can affect people, especially the ones you care about, right? And how much of a struggle it can be for them. It is not a joke. It is not something that you should ever be glorifying or making it your entire identity either, because especially if it's something that really can impact your life negatively, right? You wouldn't want that to be your entire identity, even if you do have it, right? Like you really don't want to start talking about it 24/7. Like there's nothing else about you that's interesting, because that's not the case. That's a part of who you are, but that's not it. You know, people with ADHD, OCD, depression, anxiety, any of these problems, right? You will notice if they really do have it, it's never something that they want to glorify or make it, you know, or glamorize it or say it's something so cool and fun and great. Like they don't do that. The people that actually suffer from this, they don't do that. 99.9% of the time, it's the people faking it that tend to make it their entire identity and look for other problems that they have and go through all these online quizzes and TikToks and try to figure out what else they can add onto their list of mental health problems. I was in a server with a bunch of obvious lefties who identified with the DID OSDD label. They got so mad at me for asking questions, I was literally saying things like, is this common? Can I see the source for this? And they even labeled it harassment. They just wouldn't listen to what I was asking and didn't answer any questions I asked. On top of that, they said that the disorder is common, which just baffled me. Like, why are you lying? And then they tried to convince me that there are actually multiple people in one person's body instead of one mentally ill person who thinks they're multiple people. I'm not surprised. They don't even know how to cosplay this disorder right. That's a great way of putting it. I never once preached body positivity, even after spending almost a decade being fat and ugly, and in September 2022, my weight had gone up to 220 pounds, and I'm an adult human female at 5'4", and I should weigh around 140 because of my height. I spent over a year losing 33 pounds, making it down to 187, and when people first noticed my weight loss, libs were saying that I was starving myself and I was giving myself anorexia, all because I knew all along that being fat was never healthy for me or anyone. Being fat is not healthy. Being underweight is not healthy, but in past diets lack the willpower to change physically and mentally. The libs who believe in that made up words like fat phobia to this day and called me fat because how dare I go against their worldview that fat is healthy, and I've been having body image issues because I thought I was looking better after losing over 30 pounds until the libs started saying I'm still too fat. Wow, that's really body positivity over there, huh? Oh, so now they're fat shaming you because you lost the weight. That's amazing that you lost the weight. Of course, that takes a lot of willpower, and that's honestly very impressive. So good for you. And don't listen to what they say, because again, it goes back to the fact that they don't want to see other people happy. Try to surround yourself with people who do want to see you healthy and happy. People who want to see you suffer, people who want to see you unhealthy, are not real friends. My aunt, who is an MD, is the director of several hospitals in Mexico. She recently told us how a biological man escalated his issue all the way to her, can I speak to the manager, because they wouldn't refer to him as a ma'am, and because they wouldn't let him see a gynecologist. Why would he need a gynecologist? When I was young, around age 15 to 17, I was extremely left-leaning and hated anyone who didn't consider themselves as a leftist, because I thought that being an extreme left-leaning person was the only smart choice to go for, and anyone who didn't have the same views as me, I thought wanted to harm every gay, trans, or black person, and so I was very vocal about it online. In real life, like with my friends, with my family, I was very vocal. Yeah, I love to start arguments with people, and I did think that everyone who wasn't far left was extremely, they just must be racist, they must be sexist, they must be homophobic. I was feeling extremely exhausted from all of that, but I thought I didn't have another choice but to shout my beliefs to anyone who had them wrong, aka different than mine. Back then, I didn't know that a gay person could also be more left-leaning or somewhere in between, because it didn't make sense to me, and I never really thought of that then. I also remember feeling very stressed having to pretend to like a trans man who hasn't done anything to transition, simply because I was afraid of being transphobic and I didn't want to reject them. So I remember forcing myself to like it and pretended like I didn't mind that. All in all, that time my mental health was very bad, but also leaning a bit to the right, I'm more in the middle center now, I realized that not everyone is out to get everyone and to not take things so seriously. And by doing so, my mental health did get better. If you expect the worst outcome, you'll probably attract that worst outcome. Okay, that's the truth. And if you have a political belief, right, that encourages this victim mindset, believing everyone is out to get you, that will obviously impact your mental health, which will many times impact your physical health. I think if more doctors, if more therapists, if more people in general talked about the mind-body connection, people people would need less medicine. I mean, if you just take a look at how the placebo effect works or the nocebo effect works, it's fascinating. So taking a look at the psychological influence on physical health, how the stress that stem from your beliefs, political or not, right? Also your coping mechanisms, all of that can impact your physical health. And if you're walking around looking for a negative interaction, expecting it, you'll probably find it, okay? I saw a recent video, right? It was accusing this Asian grandmother of fat phobia while the grandmother was accusing her of racism.
You look like my mom, and have a conversation with another guest in line because it's your first time at Porto's and you're trying to figure out what to order. This employee will eavesdrop on that conversation, tell you that your mom is being rude, be offended on behalf of the other guest, and be completely gagged when you find out that I speak English fluently and will call you out on your terrible behavior.
What did you said is it for you or is it for family?
So it's two people with victim mindsets meeting up. And that's what you get, especially because political beliefs, and when we take a look at the psychology of wokeness and all the mental illness you find there, of course, those beliefs can cause stress, anger, fear, and it's well known how chronic stress can affect the body. My wife, who was knocked down by a car 2 years ago, has been completely bewildered by the insane interactions with insurance company medical experts who keep asking about her mental anguish and to relate her PTSD to psychology syndrome expert. They seem to want her to have lasting mental health issues and actually get a little annoyed when she keeps telling them she doesn't have any kind of PTSD. It's as if not having a label is unacceptable. That's what we see a lot online with focusing on your trauma, with reaffirming those negative emotions. So many people talk about their trauma to get attention, to get views, see woe is you, woe is me from other people online. I want to show you this clip of Abigail Schreier talking about this on Joe Rogan's podcast.
Because you don't want the schizophrenic patient who really needs you.
Right.
They're really hard to treat.
Almost impossible.
Almost impossible. Right? You don't want the bipolar patient.
Right.
Some people will refuse to see those patients. But a teenager with a little social anxiety, parent pays on time, they're not getting violent in your sessions. And teenagers in Australia, it was called the Wise Teens Program. They talked to, that was the point. It was just to help them with emotional regulation. And it turned out it made kids sadder and more anxious. They measured this. And the reason was regularly ruminating on your bad feelings can make you feel worse. It's the number one symptom of depression is what they call rumination, this pathological obsessing over your pain.
Yeah.
That's why stuff like exercise, that's one of the reasons, aside from chemical reasons, one of the reasons that doing anything, you know that running errands is good for your mental health? Getting out of your house and accomplishing anything is good for you. But sitting around talking and thinking about your problems, that's a bad habit. What we should be telling kids is that the amazing story of human history is of resilience. Get on. They aren't permanently suffering with mental illness. They form families. They are responsible in their jobs. They show up for work. That's the story of human survival and resilience. And unfortunately, we're telling kids, no, you've had trauma.
People who do have the belief that they can change their life for the better, they have that power, they can have that determination and improve their life instead of constantly blaming it on everything else. It's society's fault. It's my family's fault. It's my friend's fault. No, it's my boss. No, it's the country I live in. No, it's this and that and something else. Like sometimes it's you. Like, really? Sometimes it really is you. And if you put in the work, if you change the way you think about the world and the way that you think about yourself, you can improve your life. But instead, what so many people do is they focus on identity politics. Oh, woe is me. It's because of my gender. It's because of my sexual orientation or my skin color, whatever else. I'm doomed to suffer. Of course, you'll end up miserable if you think you have no control over your life and you can never change. I'm happily and confidently on the center right now, but for a good few years, I was so far left. I fully embraced body positivity, or in other words, I let myself become obese and deluded myself into thinking that was healthy and okay and even attractive. Well, of course, because now if someone doesn't find you attractive, if you're overweight, that's fat phobia. I'm sure it wouldn't shock you to know I use they, them pronouns and identified as agender during that period. It's been so hard to shake that off, but after gaining common sense and quitting the delusion, I've lost 30 kilograms and am actually in the healthy BMI range for the first time in years. That's fantastic. I'm from New Zealand. There was a big issue recently over certain people getting prioritized for surgeries and other health services based on their race. Literally, they would be put forward in the waiting list solely based on how marginalized they were. The idea was to balance out long-standing inequities in the publicly funded health system, which is ridiculous since all this does is create new inequities. I feel like the only deciding factor of where you get put on a surgery wait list should be the severity of your disease. This should be common sense, but This is the world we live in. There was a huge public backlash, and so the new government has scrapped them. The worrying thing is that these discriminatory policies seem to be becoming even more popular in every aspect of the system, not just healthcare. I'm often drawn to friend groups that are more alternative. Now, those people are almost always far left. I used to be very caught up in that stuff. I've heard you mention in some of your videos that leftists can be obsessed with being miserable, and that is very true to me. It's like everything was problematic and being happy was contributing to oppression of people. I was very unhappy with these people because they convinced me I had to be unhappy. Everything is somehow tied to racism, sexism, homophobia, every book and musician and movie, and even just phrases. I even got called racist for wearing an outfit that looked like an anime character's because I was appropriating Japanese culture. I eventually left that way of thinking and became more of a centrist and open to all viewpoints. I'm happier now. When I stopped being brainwashed by the leftists, I became way less depressed. Knowing now that I'm not racist for being white and I'm not transphobic for wanting to protect kids, I feel much better about me and being honest. And I honestly don't even feel sad about any of the friends I lost due to political differences. So much more peaceful now. It is so much better to surround yourself with people who are sane. That doesn't mean you can't have friends on the left, in the center, on the right, whatever, as long as they have some sort of common sense, as long as they can sit down with you and have a conversation about why they believe what they believe, instead of immediately resorting to shouting, wanting to make it a screaming match, and getting offended every 3 seconds. That's not a sane person. And if you can't find friends like that, I think it's honestly better to be alone for a little while, to enjoy your own company, because if you surround yourself with miserable people, you'll most likely be miserable as well. Wokeism in healthcare is an epidemic of stupidity. I spent several months in psychiatric facilities, and every single group session, 3 per day, we had to go around and say our names and pronouns, which took up like 15 minutes of a 1-hour session. My cousin is a doctor, and in her hospital, the dichotomy of male and female was abandoned for the politically correct and gender-affirming AMAB and AFAB. Oh, all right. Okay, so this is a male assigned at birth and a female assigned at birth. The area she works in is amongst the poorest in my country, rife with addiction and mental health issues, and this is what they care about. Progressivism has no place in life or death situations, and if anyone thinks that their feelings are actually more important than objective facts, then they are narcissists. They would possibly rather die than admit a fact. That if you're AMAB, you're a man. Or if you're AFAB, you're a woman. As you know, many people on the left like to claim they have mental illnesses and tend to glorify them or just completely get the disorder symptoms wrong. When I was 14, I developed hand-washing OCD because I had a severe allergic reaction to some food. This caused me to constantly wash my hands to the point where they would bleed and burn. I would sleep with my EpiPen on me, wouldn't eat takeout or any food unless I cooked it, secretly took Benadryl, and had no period for 5 months due to high stress. I got diagnosed and received help, and now I'm in a better place. Now I scroll on TikTok and watch people fake OCD for views and say the most stereotypical things like, oh my gosh, I hate when my things aren't organized. Guess it's OCD. And it makes my heart shatter. OCD is not a joke. It's constantly thinking you or loved ones will die if you don't do something right. And I think it is so important to listen to experiences like this nowadays because these people, again, think it's cute, think it's fun. It's not. It's like these people have never actually met someone with a mental health issue. I remember in school, there were these girls who would love to say things like, teacher, could you please wipe that little mark on the board? I'm feeling really OCD right now. You're feeling OCD right now. Like just in this moment, you have OCD. It's like you just want to say something to make yourself seem special. But that was a common one that people say, ugh, just wipe that mark off the board. It's giving me OCD. You could say you're organized, you can say that it's bothering you, but don't start diagnosing yourself because I think it's very unlikely that 10 people suddenly had OCD and just in that one moment when there was a mark on the board or something similar like that was going on. I live in Texas and have been an ICU nurse in Texas since 2019. It's always been an issue, but I've noticed an uptick lately of illegal immigrant patients that are admitted into our unit. It was especially bad during COVID, and most of our patients were undocumented illegal aliens without insurance or money to pay for months-long hospital stays, while legal American citizens were being held in the ER because our beds were occupied. So messed up.
Now, with the record number of migrants crossing into the U.S., pushing resources to the limit in many American cities. Now hospitals are sounding the alarm, saying they're also overwhelmed, including some far from the border.
Staff here at Bellevue Hospital tell us they're eager to help, but the numbers are tough.
Our clinics are full.
And there are waiting lists, and people are turning people away or referring them to other places.
Says so many migrants are asking for legal help on asylum representation and healthcare access. Now, she says, American citizens who need legal assistance with issues like eviction and insurance have to wait up to 10 weeks.
I'm in Ontario, Canada, and the healthcare system here is terrible for many reasons. But one thing I've noticed is that the antidepressants or other related pills are being prescribed to what seems like everyone for any issue at all. Most of my younger cousins are on meds and have been since as young as 7. One of them, who is almost done high school now, has no motivation to go to school and has continued to skip several classes and not do her work or put in any effort. Rather than actually making her go to school or use any other effort to motivate, her parents took her to a psychiatrist and now have her on pills. There's nothing wrong with her. She's a capable student, and I believe she just suffers with what many teenagers suffer from: lack of motivation and not wanting to get up early or work hard. I used to be a left-leaning person until I went back to school around August of 2022. One of the main reasons I had left a lot of leftist spaces were people who would use their mental illness as an excuse for behavior is due to said people using TikTok as a self-diagnosis tool. I myself am a psychology major with autism, and I don't use my autism as a crutch as much as I did when I was younger. A lot of my ex-friends still use excuses like being manic and disassociation to justify their behavior. Right, like unless you're diagnosed, okay, you can't just do something terrible and then say, well, actually, I scrolled on TikTok yesterday for 15 minutes and I was actually just manic. They use mental illness as an excuse when they don't even have that. It's like, just say you messed up and say sorry. It's like no accountability. Okay, there's an excuse for all of your terrible behavior. On the left, you pay attention to every single emotion, to every thought that goes on in your head, and you justify it with, yes, everything is terrible. It's because of the bigots in this world, and you find a reason to feel bad. When we live in a society that tells you, focus on every emotion, focus on every bad thought in your head, and that needs a label. Oh yes, that's because you have this mental illness. You need to do this and X and Y and Z, and you need to go to this doctor and take these pills. And I know this is very controversial, but sometimes you really do have to tell your mind if you're complaining about things you shouldn't be complaining about, if you're stressed for no reason, focusing on all the negative, you really do have to tell your brain, stop it. That's embarrassing. Okay, I know it's super controversial, and I know everyone's situation is different. I'm just talking about the moments that you find yourself being ungrateful, being stressed over things that really are not that big of a deal. It's okay to tell your brain, I'm not giving that an audience. That does not deserve attention, and not focus on it and go do something else. And instead realize that there are people that are going through war, that don't have food. Maybe you have family, maybe you have friends, that you have shelter, that you have a device to watch this video on. There's so much to be grateful for and not to be taking that for granted. What happens to people who focus on the negative constantly, who like to make themselves the victim, who get bored, they create problems because of that boredom, because they're ungrateful. And you need to catch yourself and think about what you've been thinking about to practice metacognition. Because if you do, if you start focusing on the positive, if you put the phone down for a little while, I promise you'll feel better. And that's all for today's video, guys. Thank you so much for sharing your experiences. If you have your own experience you'd like to share, please make sure you comment below. Also remember to like the video, subscribe, and hit the notification bell. You can also follow me on Instagram and my other social media platforms that's in the description. And I will see you all in the next video. Bye.